hello, hello. Welcome to Be Bold America. I'm your host, Jill Cody. Our program today is Living in the United States May Be Hazardous to Your Health. Stanford professor Robert Sapolsky said of our healthcare, quote, America presents an egregious paradox. It has both the most expensive healthcare and the shortest life expectancy in the West, end quote. Living in the United States today means surviving in a society where the social fabric has been ravaged. How healthy you are is dependent on where you live. Americans suffer more cancers, heart disease, mental illness, and chronic diseases than those who live in other wealthy nations, despite having the most expensive healthcare system in the world. Why is this? This interview will embark on a journey to unravel the profound impact of public policies on American health, even from before birth. This is all reflected in the book, Born Sick in the USA, Improving the Health of a Nation, by Dr. Stephen Bezruchka. In his new book, Dr. Bezruchka delves into the intricate web where economic inequality, created by political decisions, weaves a tapestry of sickness stemming from a highly stressed society. We have big things to do. Our interview guest is that very Dr. Stephen Bezruchka. Dr. Bezruchka is a medical doctor and associate teaching professor emeritus in the departments of Health Systems and Population Health and of Global Health at the School of Public Health at the University of Washington. At the University of Washington, he received the Outstanding Teacher Award, the Faculty Community Service Award, the Outstanding Faculty Mentor Award, and the Communicating Public Health to the Public Award. Dr. Stephen Bezruchka is a returning guest. His previous interview was on his book, Inequality Kills Us All, and so far is one of the most listened to Be Bold American podcasts. Hello, Dr. Bezruchka. It is so very nice to have you back on the show. Welcome to Be Bold America.
Thank you very much, Jill. It's a pleasure to be here.
Well, it's so nice to be able to talk with you again on your most recent book. Now, you have two themes throughout the book. One is inequality and wealth, and the other is income is bad for us. How are those two themes intertwined, and what caused you to write this book at this time?
Well, I wrote the previous book to look at mortality measures. Inequality kills. I mean, I worked as an emergency physician for many years, and the easiest diagnosis I could make was that someone was dead. But not only do we die younger than people in all the other rich countries and a few poorer ones, we have more diseases. We are sicker. And we're also not very happy in this process. So I wrote the book to talk about conditions other than just mortality and to situate the importance of early life. By the time we're born, the die is cast, and a large proportion of our health as an adult is already compromised. That makes it difficult to do things on an individual basis to take care of those early life problems. Like there's no medicine you can take to somehow treat the conditions in early life that you suffered before you had any individual choices to make, or whether you had medical care or a surgical procedure that could remove the bad things in early life. It's there, and it's going to not only haunt you for the rest of your life, but lead you to be sicker and and earlier to the grave.
You say it's based, it's already in us before we're born, that we're compromised. How so? How are we compromised before we're even born?
So think about it. You started life figuratively in your maternal grandmother's womb, because the ovum that your father's sperm fertilized was made in your grandmother's womb. So your grandmother's conditions have to affect your health. And then once you are a fertilized ovum, your mother face a lot of stress. We're living in the United States. It is one of the most stressful societies that we have, according to the surveys of stress. So you're living inside, you begin as a fetus growing up in your mother's womb, and you scan the outside world through your mother's stress hormones that are passed into you by the placenta, and then you compromise your development. You make compromises to have less healthy organs in order to do what we're here to do, namely survive to reproduce. And so that happens. And so by the time you're born, these compromises have already affected your health. The other thing that I discuss in the book is studies show that even before you're conceived, the stress your mother and your father faced is probably even more important than the stress that you faced in your mother's womb. So, to follow on to Bruce Springsteen's song, Born in the USA, we're already born sick in the USA.
And the title for your book, I guess also, in addition to that, is the toxins and plastics that we have in our environment before we're even born, that the mother has in her body. I think plastics are found in the mothers and the fetuses, right?
Yes, but we don't have good studies on the harm those plastics do. It's easy to talk about them and say, well, here are all these substances, and that's why your health is compromised. Environmental issues are harder to study because you need to track the exposure over long periods of time. So it's easier to sell microplastics as being the harmful agent than it is our highly stressed society.
So you have the two themes throughout the book. One is inequality in wealth, and the other is income is bad for us, and that they're intertwined. Can you tell us more about that?
To begin with, we have more poverty in this country than in all the other rich countries. It's important to recognize that poverty is a policy choice. And so we have decided to, especially today with the most recent legislation, to let the rich have more than they ever dreamed possible, and we're working hard to do that. And so that creates more poverty in this country and more inequality. And the critical point that is important to recognize is the health of the richest people. Richer people tend to be healthier than poorer people. Studies that I detail in the book show that the richest people are not as healthy as lower income people in other rich countries.
Oh my!
In other words, when people are young, they want to be rich, and once they become rich, they want to have the health of young people, but that's denied them in the United States, and so we really have a very compromised situation. However you want to conceptualize how healthy someone is, the healthiest people are not found in this country.
Wow, you also made the statement in your book that there's no honor system in place in American politics, and you were talking about poverty as a policy choice, and that there's no honor system in American politics. Can you expand on that? You said it very succinctly, and I think we observe it every day that there's no honor system in our American politics, but how is that reflected in healthcare?
Well, you mentioned the word healthcare. That's the first time this has come up. So we tend to think it is healthcare that produces health, and our language doesn't serve us. We speak of accessing health, paying for health, getting health, ensuring health, and all those are about healthcare. And healthcare is a relatively minor player in producing health.
Can you expand on that some more? Could you expand on that last sentence some more? Because most of us think of healthcare is what we need to take care of our health.
Yes. I mean, if I ask somebody, do you want health or health care, they're confused. Because, as I said, our language confuses us. So how important is health care in terms of producing health? Well, there's a lot of studies out there showing in the United States at best for averting mortality, that is, for not dying, healthcare amounts to about 10% of the effect of averting mortality. So that leaves 90% to be explained by other factors. What might those factors be? Well, attention to early life. If we compromise early life, healthcare can't really impact that. We tell a pregnant woman to attend prenatal care clinics, but those are relatively minor in affecting the birth outcomes. So, internet surveys show that people in the United States rank healthcare most important for health and politics least. But the studies show it's politics that matters most, because the political choices we make decide how much poverty we have, how much we let the rich have beyond their wildest dreams. I mean, we're going to have the world's first trillionaire soon. The healthiest person, the wealthiest person on the planet got a pay package of $1 trillion over the next 10 years. That's obscene. I mean, it is those factors, the inequality, that is literally killing us and making us sick. And Americans deserve to know this to see whether or not they want to have these outcomes.
Well, I'm going to take a break now because I can see my questions that I have ahead are going to take long answering. So let's just break right now. You are listening to Be Bold America on KSQD 90.7, 89.5, and 89.7 FM. Many voices, one station. Listen globally online from the KSQD.org website. Our topic today is living in the United States may be hazardous to your health, and we're speaking with Dr. Stephen Bezruchka, author of Born Sick in the USA, Improving the Health of a Nation. I'm your host, Jill Cody.
Hey, Tom Hartman here. You know how I always say democracy is not a spectator sport? Well, Jill Cody knows the rules of the game, and she delivers it to you straight on Be Bold America, Friday at 5 p.m. right here on KSQD. Jill brings in the best political thinkers of our time who will show you what to keep doing, stop doing, and start doing to support democracy in our world. That's Be Bold America, Friday at 5 p.m. right after the Tom Hartman program, right here on K-Squid, 89.5, 89.7, and 90.7 FM and KSQD.org. Tag, you're it.
Coming Saturday, March 14th, it's Squid Fest West, a fabulous concert and silent auction to benefit K-Squid. It takes place at 612 Ocean Street with performances by local favorites Puffball Collective, Slack Key Guitar Master George Kahumuku Jr., Hoy Rogers, Coast Ridge Ramblers, and the original acoustic duo, Dan and Laurel. Tickets are limited and available now at eventbrite.com or click the link on ksqd.org.
But I'm out on the road again. I'm on the road again.
Whether you're on the road or at home, you'll never be without your squid. With the KSQD app, you can take the squid everywhere. Connect with your favorite host. Learn about new music. Text a request or comment. Browse our podcasts. Record a message and listen uninterrupted while you browse. Download the KSQD mobile app for iOS or Android at ksqd.org or in your app store.
Today, our topic is living in the United States may be hazardous to your health. And we're speaking with Dr. Stephen Bezruchka, who is a physician and associate teaching professor emeritus in the Departments of Health Systems and Population Health and of Global Health at the School of Public Health with the University of Washington. Now, Dr. Bezruchka, you also talked about power. You know, the definition of power in your book, I'd like you to explain. And then whose interest is that power exercised, and can a person with power be gotten rid of? You say if it is not possible to get rid of them, then you do not live in a democracy. So can you expand on all that about power and getting rid of people with the power, because we don't live in a democracy if the power is in their hands?
So let's consider power as the ability to cause pain or pleasure in other people at little cost to yourself. So who has power? Well, in this country, the ultimate power seems to be vested in a single person, the president, who is creating all sorts of havoc throughout the world, and this is not good for us. But Tony Benn, who is a British parliamentarian for 55 years, I believe, said, if you can't get rid of those in power, you don't live in a democracy. So I would say the rich and powerful in this country are not serving us. They're also not serving themselves, since, as I mentioned, they're not going to live a long, healthy life. The issue is, or the challenge is, to convince those with power to share their power, and we'll all be better off. That's a tall order. Trying to tell the rich and powerful that their health is compromised by all the policies they create is really a tough job.
In the book, too, you write about Americans are really reluctant to accept the policies that would have a great and beneficial impact on them. I think those in power now seem to be creating that environment where we are reluctant to even accept the policies that would help us. Am I saying that clearly?
Yeah, I mean, you know, today's situation is really disastrous, and but it's, you know, our poor health status began long before, and a study, for example, that I quote in the book says that if the rich don't support policies, they're not likely to become law and followed through. So, you know, it really is the ultimate catch-22. We have policies in place that create a lot of harm, and we seem to not be aware of them and want to change them, and our media don't serve us. I mean, you know, your show is an aberration in that you'll discuss these things, but hardly any politician wants to touch the ideas in the book because it won't get them votes. You know, people are mostly, don't want to believe that their health doesn't depend on getting health care and on their personal behaviors. You know, I mentioned our healthiest state, our longest state is Hawaii, and how the Department of Health in Hawaii situates politics as the most important factor impacting health, and personal behaviors and health care as the least important. But, nobody seems to want to consider that.
Well, I actually looked up in my own book about, because you mentioned the study of Martin Gilens and Benjamin Page, and you talked about, too, that there's little protest, public protests, as the powerful have chiseled away at our safety net. You've written that the Americans are really unaware of the scale of the heist, on the middle class and lower class wealth, how much has transferred from us to these 0.0001%. And back in, just to add to the scale of the heist, which I love that phrase in your book, back in 2014, Martin Gillens and Benjamin Page studied 1,771 bills passed in Congress. What they found was that, and I'm quoting here, quote, when the preferences of economic elites and the stands of organized groups are controlled, the preference of the average American appeared to have only a minuscule, comma, near zero, comma, statistically non-significant impact upon public policy. That study was 12 years ago, and it hasn't gotten better. I mean, I don't know what's smaller than minuscule, near zero impact, but that's where we are.
Yes, so, the scale of the heist from 1975 to 2023, $91 trillion was taken from the bottom 90% and transferred to the top 1%. That's a 2005 RAND study. And, we have a hard problem. We have difficulties with large numbers. So $91 trillion, how much is that? Well, if we take our largest currency, a $100 bill, take a freshly minted stack of $100 bills and stack them from the ground up to reach $91 trillion, how far would they go? A quarter of the way to the moon. That's how much we have voluntarily, if you want to make that point, given up so the rich can be ever richer. Now, that's just to the top 1%. And as you point out, the 0.001 or whatever percent has taken most of that. The paradoxical thing, which I mentioned in the book, a study by Culpepper, if you take the ideas of the harms that inequality do and you present them to people in 5 countries and then ask what they should do, in the other 4 rich countries, people say we got to decrease inequality. But in the United States, people seem to want to increase it. Now, why might that be? I think some of it has to do with a cartoon I mentioned in the book. A banker dude and a worker dude are sitting in a bar, and the worker dude says to the banker dude, I'm all for tax cuts for the rich because I might win the lottery someday. So the American dream is alive and well in this country. Somehow, people believe that before they die, they're going to strike it rich, and they want to really win big. And so let's not have taxes on the rich.
I would call that the American delusion.
It's an American nightmare.
American nightmare,
you gotta be
exactly.
To have that dream.
Wow.
So there's a real problem here. We keep the undertakers busy by dying young, and the coffins that they put us in have no pockets in them. You can't take it with you.
One of my favorite quotes for those who remember the Chronicle owner Howard Hughes. My joke was, you didn't see Howard Hughes taking it with him.
Yeah.
You don't see any of them taking it with them. Exactly. No pockets in the coffin. You also state that political issues are the most important detriment to health. And how did this happen? And what are loud policies and quiet policies?
So loud policies are spending on Medicare. The Medicaid cuts that are that were enacted a short while ago, they got a lot of condemnation. That's a loud policy. And, so medical care has a big lobbying group, and it's our system in this country is profit care. And in 2024, we spent $5.3 trillion on medical care in the United States, and that's 18% of our total economy. So, that's the fact that we spend so much money on it suggests we should get something from it, and so that's part of the reason that we are focused on medical care. The trouble is, because we spend so much money on medical care and it creates such huge profits, we don't think of spending money where it really matters most. So where would that be, spending money where it matters most? Well, since a large portion of your health is determined in the early years and maybe even before you're conceived, countries that are healthier spend money on early life. There's only 2 countries in the world that don't have a national policy of paid maternity leave. One is, of course, the United States, and the other is Papua New Guinea.
Interesting company.
We don't put
Oh, gosh.
we don't put our money where it really is going to matter.
Mm-hmm.
Spending money on early life would be a quiet policy. Mm-hmm. We have now huge numbers of unhoused people. We pay a little attention to providing housing for them, but when did the homeless first appear? I have a very vivid memory that I started seeing them after 1980, when President Reagan cut funding for low-cost housing as well as mental health care services. And so because we redirected funding to places where it doesn't impact health very much, we pay the ultimate price in dying young and being sicker.
Well, I remember Reagan, when he was governor of California, closed all of our mental health institutions. And where did they go? So he just brought that same ideology of they're not worth public dollars, I guess, and brought it to the United States as a whole. And you're right, our homelessness has just grown since then.
Yeah. So the whole idea of mental health is another enigma. When you look at being dead, that's hard to fake. When you look at various diseases, we have ways of diagnosing them. Mental illness is a much softer idea to categorize and say you have a mental illness. There's the Diagnostic and Statistical Manual that lists the criteria for diagnosing mental illness, and it's a very complex thing. I talk in the book about studies on mental illness among countries. Again, that's my focus. We need to look not on, a person who knows only one country knows no country. So I try to understand health issues in other countries to understand what's going on in the United States. And in my chapter on, title is America Driving You Crazy, I discuss studies on mental health around the world, point out we appear to have the most illness of all countries, and paradoxically the most treatment. And that suggests that treatment may not be very effective. And that's really a conundrum. I'm teaching this course at my university right now, Health of Populations, in which the patient is the country. And I have several students in the class who've been absent because they've had to be hospitalized for mental health issues.
Oh, my.
That's not a good situation. But it's, if you ask people how stressed are they, my young students certainly feel more stressed, and they feel more mental problems And what are we doing to solve this issue? How many times today have you been told to have a nice day?
Mm-hmm.
We're not having nice days, and telling someone to have a nice day is not going to be successful.
If you're just joining us, we're speaking with Dr. Stephen Bezruczka, who is the author of several books, and we're speaking with him about his most recent one, Born Sick in the USA, Improving the Health of a Nation. So, Dr. Bezruczka, I have a special song for you. Louise Hartman has been writing political lyrics for our times and putting them to music. They are poignant, and I found that one fits our topic. I've been outraged for years regarding a few rich people in this country profiting and getting richer and richer off of all of our suffering and death. You have a pain, they make a buck. You break a bone, they make a buck. You need medication, they make more bucks. So anyway, the song is titled The Promise That Could Heal a Broken Nation, and I'd like to get your take on the other side.
They say we're free, they say we're strong, but we can't heal what's gone so wrong. A mother cries her child can't pay for the pills that keep the pain away. We've built our dreams on borrowed time, turned mercy into dollar signs. This is the promise that could heal a broken nation. A vow of care, not cooperation. Healthcare for all, not just a few. The soul of a country depends on what we do. From city streets to heartland towns, the same old sickness trickles down. A working hand, a weary face, still waiting for saving grace. It doesn't take a miracle to stay alive. It shouldn't take a fortune just to survive. This is the promise that could heal a broken nation. A simple truth of restoration. Let mercy lead, let kindness reign. And we'll never be this lost again.
Dr. Bezruczka, we just heard Louise Hartman's song, The Promise That Could Heal a Broken Nation. Have any thoughts to share with me after hearing it?
He does imply that healthcare is what produces a broken nation. Diseases are mentioned. I'm
And healthcare is
I'm
affecting the
almost-
national debt, too.
Yeah. Most of the popular songs today have themes that are problematic issues. As I came of age in the 50s and 60s, Love Me Tender and really warm, embracing songs were the norm. And now most of our songs are about the pain we feel, as this song talks about. So
Maybe a way to manage our stress.
Yeah. So how do we manage our stress? Well, we consume about 80% of the world's opioids. Okay, we're
Wow.
4 or 5% of the population of the world, and we consume an enormous number of opioid drugs and substances. You know, when I go to school to teach my class, I pass this big billboard about fentanyl. And, you know, there was no big billboard up there about fentanyl 10, 20 years ago. But since we consume so many of these drugs, we must do it because we have a need. And, I mean, probably you and I mean, I don't take opioids. You probably
Neither do
don't
I.
either.
I never even smoked.
Yeah. I tried it, and I even inhaled, but I better not say that.
I remember. I know where that quote comes from. I know.
Yep. Anyway, so why do we consume so much of these drugs? Well, as I said, we're one of the most stressed countries in the world. Opioids are a reasonable stress reliever. But like most things we do to try and relieve stress, they only work for a little while at the particular dose, and then you need a larger dose and a larger dose, and eventually you overdose and die. 100,000 deaths from opioids was, we plateaued about a year or so ago at that number. There's about 3 million deaths a year in this country. So that's moving right on up there. Why, why do we seek relief from our stresses by such substances as opioids, fentanyl, and so on? Well, first of all, recognize that trying to decrease supply, remember we invaded Venezuela because we thought that decreasing supply of drugs is going to benefit us. But no, there are many other sources. Rather, we should be asking, why do we need so much of these substances? The war on drugs was started in 1971, and we're not winning.
No, we're not.
And so we have to understand why. So let's look at some studies. I live in Seattle, and north in British Columbia at a university there. They did a study in which they put rats in social housing, namely a whole bunch of rats together, and rats housed individually. And then they offered them morphine. Who used? The social housing rats didn't need it. They had all the social connections that made them feel good, but the individually housed rat couldn't get enough of the morphine. So think of loneliness in today's society. We have an epidemic of loneliness. What do we do about it? Well, nothing. In the United Kingdom, there's at least a minister of loneliness. Loneliness is an increasing problem, at least in many places, because of our devices that make us alone together. But we have no way of addressing our loneliness epidemic. What I did this year in my class was I told people they couldn't bring their devices into class. We had to engage with one another. Before, yes, they might be taking notes on their computer, but they might be shopping or doing something like that. So, why do we use these devices very much? A week ago, I did an exercise with my class in which I asked them, what is the business of the media? In a business, there's a buyer, a seller, and a product. And I asked them to take, say, social media, and who is the buyer, who's the seller, and what's the product? And I said, follow the money. Well, you don't pay anything to go on Facebook or Instagram or TikTok. You can go to a coffee shop and you can access it for nothing if you don't have, but everybody has access. So you can't be the buyer. You're not paying any money. Who is the buyer? the advertisers. What are they buying? What's the product? You. The producers are selling you to the advertisers. That's the business model of the social media. And the other media, too. I mean, how much does it cost to listen to the radio program that you're airing? So once we recognize why, we have this form of capitalism, Shoshana Zuboff calls it surveillance capitalism. It's just a form of selling us to the advertisers, and it's not helping us.
The iPhones and the tablets and is all keeping us more and more divided, and I think that's a big influence on this loneliness that you're talking about. Everybody's sitting around. Sometimes you go to a restaurant, you see everyone in the family sitting on their, looking at their iPhones and nobody talking to each other.
Right.
Oh, geez. Well, I want to take a break right now because I know my next question is going to take a while to answer. And we've also got our keep, stop, starts that I want to get to. So it's time for a break. You are listening to Be Bold America on KSQD 89.5, 89.7, and 90.7 FM. Many voices, one station. I'm Jill Cody.
And we'll cut in now here from the coastline of Northern California, where a giant squid has washed up on the beach. You could see some onlookers there. So this squid has got to be 120 feet long before the tentacles are even stretched out. A truly amazing find here.
Amazing radio at 90.7 FM. K-Squid.
We have never seen a squid of this magnitude before. We thought they existed, and they indeed do.
KSQD Santa Cruz. Online at ksqd.org.
Float like a butterfly, sting like a bee. You're listening to KSQD. Friday nights at 6, it's the Downbeat Shuffle program. Caribbean Basin sounds from the 50s and 60s, only on K-Squid, 90.7 FM.
Hey, Squiddies, it's me, Jennifer, from the Zombie Jamboree, and you're listening to KSQD 90.7 FM and KSQD.org. Join us every week at 8 p.m. for your Friday night mixtape, the cornucopia of specially selected songs for your listening pleasure known as the Zombie Jamboree. C-Dub and I always enjoy your company. That's Friday nights at 8 on KSQD 90.7 FM.
Today, our topic is living in the United States may be hazardous to your health. And we are speaking with Dr. Stephen Bezrutska, author of Born Sick in the USA, Improving the Health of a Nation. Now, Dr. Bezrutska, I was particularly impacted by reading about healthcare differences between conservative and liberal states. What are they?
You're using the... You're speaking of health care.
Yes.
And I think we should talk about health. I think you meant health.
Health. I'm sorry. Yes, I stand corrected.
That's the problem that everybody in this country faces.
It's so ingrained in us, but you're right. Health.
Yeah. Well, studies that I depict in the book looked at life expectancy trends from 1957 to 2017, I believe, among the 50 U.S. states, and they saw which states made the largest improvement in life expectancy, how long you live, and which states didn't. And then they looked at state policies being liberal or conservative, and the longest lived states all had liberal policies, and the shortest ones all had conservative policies. And some states, the worst off state in terms of health outcomes and most other factors is Mississippi. and it's right down there at the bottom. And they continually have all these conservative policies. Now, what does conservative mean? I have to go and look at there's a whole, I have a whole list of these different policies, but, do they have Medicaid access broadly distributed as a liberal policy? Do they have housing support? Do they have transportation support? Do they are they liberal on abortion policies and so on?
And protecting marginalized groups.
And protecting marginalized groups. Yes, I mean that's really. If a state can enact liberal policies, they're going to see health improvements that the conservative ones don't. And as I said, our healthiest state is Hawaii, and in the graph, I don't remember if the graph is in the book or not. I don't think it is. But, Hawaii has liberal policies, and also some studies suggest less racism. The least racism is in Hawaii because it has rather a diverse population, and so people have to get along. Mississippi, also a diverse population, but boy, there's a lot of racism down in the Southeast. This brings up the issue of since I'm interested broadly in the government at the national level, there is a chart in the book looking at how much governments in 5 countries, Sweden, France, Germany, Britain, and the United States, accrue the governments in terms of tax revenue. And I highlight Sweden as 55% of the income goes as tax to the government in Sweden, 30% in the United States. This is data to about 2015. And so a large proportion of Swedes pay money to the Swedish government, and then what does it do with that money? Well, liberal policies of universal health care, free education at all levels, housing support, transportation support. Swedish government spends more money on the first year of a person's life than in any subsequent year. And they spend a lot of money there. I mean, those are health-producing policies. At 30%, what does our U.S. government spend its money on? Well, we spend $1 trillion on the military. That's slated to be increased by 50% very soon. We spend money on Social Security. That's for old people. We don't spend much money on early life. Remember, only 2 countries without a paid maternity leave policy. So our government doesn't take much in taxes from the people and spends it on things that don't improve our health. By the time you're 65, Social Security is not going to help you live very much longer. If we had a guaranteed income program in early life, that would be an example of a liberal policy that would really work.
There's a part in your book that I wanted to share. It's where you talk about more liberal state policies of regulating firearms, labor, environment, criminal justice, taxes, and tobacco led to a lower mortality rate. And if all states had a liberal policy orientation, there would have been over 170,000 fewer working-age deaths in 2019. If all states had conservative policies that year, more than 215,000 such lives would have been lost. A variety of things. Now that firearms is the number one killer of children, this is, I just wanted to point out that the liberal state policies are saving lives.
And to try and put this in perspective, you mentioned the number of lives saved. And that would be the equivalent on a year, that would be the equivalent of 2 fully loaded passenger jumbo jets crashing every day in this country.
Oh, my goodness.
And, that doesn't make the news. What makes the news? Well, as a media person, your motto is, if it bleeds, it leads. So, we'll have today's mass shootings still make the news, but they're not on the front pages anymore since we have so many of them. But these, what one might call structural violence policies, the fact that we have all these conservative policies are a form of violence related to the structure of society. And so I always try to make comparisons with things that people might be able to objectify. For example, I have my students calculate how many children under age 5 would not die every day in this country if we had the child mortality rates of the country of birth of our First Lady, Slovenia. The answer is about 43 children die every day in this country that wouldn't if we had our First Lady's country of origin child mortality rate.
Well, that is a very interesting analogy. Thank you, Dr. Bazruka. Now, keep, stop, starts. Just in the next minute or so, we must take action in improving our health and improving our systems that will help increase our health benefits. Our future depends on it. I think your chapter 10 starts talking about that, toward a healthy United States of America. But you also say decreasing inequality will produce healthy changes in the United States. So what can we do to keep doing, stop doing, and start doing? And I'm sorry to say we have about 1 minute for that big question.
Well, our president has to report to Congress on the State of the Union, and he did just recently. Suppose he was required to compare the state of our union with other unions. The speech would then be something like, well, Americans, we live shorter lives than people in 40 or 50 other countries and have more illnesses, but that's a small price to pay for living in the United States. Suppose we had a real State of the Union address comparing our union with others. Then the media would pick it up. Otherwise, the media don't. One other way to make this better known is to put questions on the various exams that we're required to teach, to take, beginning in grade school, then to the SATs and the other exams. Suppose the material on the exam addressed our health status, the kinds of things I've been talking about, and made comparisons with other countries. Then we'd have to teach to the test. And so students would grow up in early life learning this material and then want to do something about it.
Dr. Bazruka, you have written another brilliant book. Thank you for being our bold and inspiring interview guest today. It has been a real honor to speak to you again.
My pleasure. Thank you very much.
It has been all mine. Thank you. As a reminder, Be Bold America is available as a podcast. Now you may listen to the show anytime for free by subscribing through your favorite podcast platform or by joining Be Bold America's news group. To do so, visit JillCodyAuthor.com and complete the pop-up form. I want to give a special thank you to our program engineer, Elena Wechter, and to our station's program director, Howard Feldstein. You are listening to KSQD Santa Cruz and KSQD Prudendale. Many voices, one station. Listen worldwide online at ksqd.org. My name is Jill Cody, and I want to thank you for listening to Be Bold America. Until next time, keep, stop, start.